So looking further at chemotherapy medications, now we look at treatments to lower estrogen levels as we looked at treatments that would block estrogen formation. We're now just looking at lowering estrogen levels. Aromatase inhibitors block aromatase in fat tissue. So fat tissue in postmenopausal women has the ability to produce small quantities of estrogen. So this just blocks that ability of fat tissue to do that. So again, your side effects are present here. And again, that's going to be used in particular in women who have non-functioning ovaries, because obviously if they have non-functioning ovaries, or if their ovaries have already been removed, they're not producing estrogen, and obviously from their ovaries, they're basically producing it primarily from the fat tissue. Now, some individuals will just have permanent ovarian suppression or ablation. That could be done surgically. Oophorectomy is removal of the ovaries. So that is another thing that can also be done for these individuals. And again, ovarian suppression utilizes luteinizing hormone releasing hormone to reduce the ovaries' production and release of estrogen. So those are the various ways, again, that in this instance, obviously, we could either lower estrogen or, as I had talked about on the previous slide, ways that we can just block estrogen formation from occurring. So again, that's kind of a way to, again, start to remember this. Think of, well, we can either block it or we could lower it, and then from there kind of, go down to the types of medications and the ways in which that gets performed. That could be just a way to help you remember it. So hormone therapy that lowers androgen levels. So this is again common, so again, we're commonly looking at this in males in particular for particularly for treating prostate cancer. So in orectomy, which is basically removal of the testicles, one or both of the testicles are removed, that's going to reduce blood testosterone levels significantly. In the case of what we call a subcapsular orectomy, only the tissue that produces androgens is removed. So again, some of the common side effects of hormone therapy in treating prostate cancer, males can experience hot flashes, loss of libido, changes in mood, depression, erectile dysfunction, gynecomastia or growth of the breast tissue, tenderness in the breast tissue, shrinkage of the testicles and the penis, muscle atrophy, reduced muscle strength, bone loss, anemia, high cholesterol, weight gain, lower mental sharpness, fatigue, increased risk of hypertension, diabetes, liver damage, stroke, heart attack, and death from heart disease. So various effects there. Another way is luteinizing hormone releasing hormone could bind to the LHRH receptor in the pituitary gland and also lessen testosterone production. So that's another way that androgen levels can be lowered in a situation where, again, in particular, as a form of treatment for prostate cancer. So again, there's going to be significant physical side effects to this. So again, a lot of your cardiovascular side effects that I had mentioned, structural effects on the musculoskeletal tissue, and again, just, typically what you would see as far as the hormones getting disrupted in a male, some of those common side effects. So again, further discussion on hormone therapy to lower androgens. Again, your LHRH antagonists. So now these are also termed GnRH antagonists. GnRH is also known as gonadotrophin releasing hormone. They're also referred to that GnRH antagonists. They tend to decrease testosterone levels even faster than the LHRH agonists, which we had mentioned on the previous slide. Abiraterone or Zytiga is an androgen biosynthesis inhibitor. This is just going to reduce the androgen production from the other cells in the body. So there's other cells, obviously, besides the testicles that produce androgens. The adrenal glands would be one of them. The prostate cancer tissue itself is also going to produce androgens. So this looks to particularly lower the androgen production from those particular tissues. Then you have the drugs that stop the androgens from working. These are called anti-androgens. These particularly bind to the androgen receptors, and usually they'll use this treatment in combination with orectomy or an LHRH agonist to block the androgen production. And there's specific medications that they will use also in conjunction with that. So they'll usually use this to basically bind to the androgen receptors. It'll block it, and they'll use it in combination with one of those other treatments, either the testicle removal or with an LHRH agonist. So that brings us now specifically to exercise. Again, exercise, the idea here, just as we would with anything else, but in particular to cancer, we know that we could improve, kind of overall quality of life and some of the other physical markers. And, the idea is to hopefully help the person, be able to kind of, tolerate what they're kind of experiencing with the cancer. And to, in particular, we had noted the issue with fatigue and how impactful that is, and this can kind of help break that cycle. Again, benefits vary, but it's going to be important to look at the type and stage of cancer that they're in. So again, when you kind of look at that to kind of really kind of determine, exercise volume and everything. And there's a lot of progressions, and I'm gonna be recommending you. It would kind of help that process make sense to kind of look at some of the tables and just kind of see, for example, some of the progressions beyond just looking at like the general recommendations. That could certainly assist you with that. Most of the research that you look at regarding exercise has been focused on breast and prostate cancer, in all likelihood, because in most instances with those types of cancer, it's probably much easier for individuals to remain active. Those are both very treatable forms of cancer. They obviously still are very difficult to overcome, and you can have issues with them. But those are probably two of them where physical activity can be sustained probably much easier than a lot of other forms. But that's where most of the research has taken place. So certainly they're looking to do a lot more research regarding cancer and the impact of exercise. They have started to do some studies in children that have pediatric leukemia. They're starting to look at that a little bit more, but this is where most of the research has looked at. So looking at aerobic training, so we know that aerobic training can reduce nausea, it can improve functional capacity, greater mobility, body composition, fatigue, well-being, improved hematological and immune system variables. So those are certainly some things regarding aerobic exercise. Again, some of the important thing to do would be, again, just kind of monitoring your volume. And again, you could kind of see when you're looking at kind of the recommendations where a lot of the intensities kind of lie, but that's really what you'd want to be looking at. Again, making sure it's at an intensity, making sure that it's at a duration where they can certainly be able to maintain their activity level. So look at resistance training. Again, here you have the various markers that could be improved upon with resistance training. Obviously, a lot of the structural benefits. When you combine the two, there seems to be a lower incidence of recurring breast cancer-related lymphedema. So lymphedema obviously is one of the big concerns that we get concerned about. But we've actually found that when you combine these two, that there's a reduced level of that. There's a reduced severity there's a reduced severity in the lymphedema as well, and there doesn't appear to be any immunological recovery issues, or there also is improved chemotherapy completion rates. So that's kind of an important thing there too. The chemotherapy completion rate. So making sure you're active can make your body kind of a little bit more resistant to the negative side effects of chemotherapy, because obviously you want to be able to complete the chemotherapy to avoid any, in cases where, the cancer could reoccur, that could limit that. As far as the resistance training goes, or just even the exercise in general, again, like a lot of other, no different than programming for anybody else, you want to make sure that you have your 3 parts of your session, your warm up, your main session, your cool down. Focus in particular, again, your training sessions are gonna, in many instances, particularly early on, are gonna have to be pretty short. So focus on the resistance training aspect of large muscle groups. And again, those movements and muscle groups are gonna have the greatest carryover to your activities of daily living. So, if the person's able to do things like squats, multi-joint pressing, multi-joint pulling, those would be the things you'd want to kind of focus on early. Even if they're only doing 3 or 4 movements, as long as you're addressing all of the muscles within that to start, and then possibly progress them and add exercises down the road, keeping in mind your symptoms. If they're experiencing fatigue, keep the exercise session shorter. The initial goal is to gradually, over the course of a couple weeks, increase the time to 40 minutes. So I think your book recommends over a 4-week period, gradually increase to 40 minutes. Would be something that you would want to, when you're looking at overall duration of the exercise. And for the most part, that's what you would be. Again, it'd have to be much more gradual if someone's really experiencing a lot of side effects, or if they're severely deconditioned. If they were, particularly if they were inactive before their cancer diagnosis. So review your recommendations in table 5 in 10.5 for adults and table 10.6 for children. So there's some things to kind of note, kind of gives you some intensity ranges to kind of look at with that, and some volumes to look at. Again, any guidelines need to be individualized. If we're just talking from a practical standpoint, they need to do that. If you look at the resistance exercise, they recommend about 30 to 80% of 1 repetition max as kind of the working intensity for resistance training exercise. For aerobic exercise, they give some recommendations in the case of children for a percentage of max heart rate or heart rate reserve. So max heart rate between 50 and 90, heart rate reserve 40 and 85. For the adults, they just kind of go with a self-selected intensity, and they actually use the rating of perceived exertion. That actually wouldn't be a terrible idea for children as well. You can certainly do that if you don't want to use heart rate for the children. Again, goals should be similar to those who are for healthy individuals. Exercise for the most part is generally safe and brings with it benefits as far as individuals with cancer are concerned. So some other particulars for adults, they didn't mention, again, 4 to 5 times a week. Again, kind of looking at your overall time, I would say walking is a good starting point, particularly if you're, either dealing with somebody who is going through a pretty vigorous treatment that's bringing with it a lot of fatigue, or if their cancer's, staged very high. Large muscle group activity can be good as long as it doesn't interfere with any recent, if they've had surgeries. So surgeries are kind of another thing in addition to the pharmacologic treatment or any other thing getting done, just because you want to make sure tissues in the area have healed appropriately. Again, your resistance training, I kind of gave you the intensity range previously, but again, 8 to 15 repetition max. And again, even if you're just starting with, I know they say 8 to 10 exercises for major muscle groups, but just as an aside, like I would even say, if they're physically functional enough to do weight bearing and big movements, if you just pick basically like a push, a pull, a hinge, and a squat, if you think about it, that's really going to cover everything. So, again, a lot of times early on, we're just trying to see how people respond. You can do fewer exercises with something like that. And then if they seem to be responding to it well, then expand that out and then maybe do some single joint work. Or, you obviously have to keep in mind if they can't maybe do a squat, that, maybe weight bearing is a little too much for them. You may have to scale it back to single joint. And then in that instance, you could add more exercises, because obviously the exercises aren't going to be that fatiguing. Flexibility can be done 3 times a week. Again, make sure that the intensity doesn't reach the level of discomfort, they recommend about 10 to 30 seconds for your flexibility exercises. Now, exercise precautions. So this is an important thing, and I'm not going to read every single one of them word for word. I am going to, have you highlight table 10.7, and I'm going to mention some things. So again, medical clearance is strongly encouraged. If someone's receiving treatment that affects the heart or lungs, so this should make a lot of sense. Obviously, if they're physically exercising, the heart and lungs are going to have to work harder regardless of the exercise, because the lungs and heart are obviously still going to work very hard even during resistance training. So like, for instance, if they're getting chest radiation therapy or they're taking like a bleomycin, that's going to impact the lungs. If they're doing an anthracycline treatment, that puts the heart at risk for some issues. So just be mindful of that. But it's going to be really important to look at that, and also look at the other pathologies and conditions. Like, for instance, if an individual is experiencing fever, if they're particularly a high body temperature, all that exercise basically needs to be held off. If they have a severe thrombocytopenia, where basically they have a low platelet count, if they have severe neutropenia, which is basically a low neutrophil count, which would show that their white blood cells are really low, or a severe anemia. So, and again, that table kind of highlights that. So there's various kind of pathologies or issues that the cancer patients could have. Again, if they have, low to moderate cachexia, if they have low to moderate anemia, those are things that that would obviously augment the intensity. So, whether it's the medication or whether it's something specific to the condition. For instance, breast cancer survivors, you have to watch for symptoms of lymphedema in the upper extremity. Prostate cancer survivors, you have to be aware of the risk for fracture, and you're probably going to want to do, particularly if they had a radical prostatectomy where they've removed most of the prostate or a part of the prostate, they'll have to do pelvic floor exercises to help with their bladder control. So that's all important stuff to know. And again, that's all in that table. So those would be some major important things, because from a practice perspective, those would be the things. So we keep saying, and you hear this many times, again, you can, for a lot of conditions, you can use the same general recommendations as you could for the population. But these would be situations where that would be kind of modified. So that would be really important to recognize. They also say that there's more research needed on kind of minimum platelet counts and hemoglobin. But that would be if you're having a severe lowered platelet count or something of that effect, that would require the person to significantly change what activity they were going to do. And then particularly for lymphedema, so we had mentioned this earlier, that you can still do upper body exercise, but just perform it with caution. And in many instances, that the healthcare professional may totally not want to do that. Again, kind of depending on them. So look at their symptom response. So you might want to reduce or stop a specific exercise according to the symptom response. Certainly precautions could take place, and these would be things that would limit lymphedema in individuals, so they can wear compression sleeves. Lifting the arm above the head after exercise can facilitate removal of the lymphedema as well, or just even active light recovery. So, again, just light range of motion exercises, for instance, can help with that, because the lymphatics require muscle action in order to work. So, when you're looking at kind of the vessels in the body, obviously, like the arteries have a muscular layer, and the arteries are kind of, self-pumping, if you will, whereas the veins and the lymphatic vessels, they need muscle contraction in order to facilitate the movement of the fluid. So certainly that could help. As far as lower limb, again, just be mindful of it. So we had talked about how there's certain types of cancers that would obviously put an individual more at risk for lower limb lymphedema. Again, it's just something to be mindful of, but use caution when treating patients that may have that, or they have a cancer that could possibly lead to lymphedema. And then some other, again, program design guidelines, again, individually supervised. Again, I really encourage you to kind of, in the back of your mind, have a lot of those. And again, always be mindful of the terms. So in other words, you should know what neutropenia is. You should know what thrombocytopenia is. You should know what cachexia is. So again, those should be things that, again, the medical terminology is important here, that you could at least recognize what those are. Aerobic exercise, again, begin with walking, again, so lower your intensity a little bit, particularly for someone who is deconditioned. Again, resistance training, at least one exercise for all major muscle groups. Like I said, if the person is able to do larger movements, that'll make their early programming much more efficient, and again, would be better as far as carryover for activities of daily living. So that could certainly be of benefit for those individuals. And again, for clients who are severely affected by their condition, they're highly deconditioned, again, begin at a lower level. So, and the guidelines for the most part, like for instance, even with the resistance training, it's a pretty broad range of intensity. So it does kind of set the stage for that, if you will. But that certainly allows you to, give you some room. And again, it never hurts if you're unsure just to be a little low on the lower intensity side. It could just also kind of encourage them and kind of start to build that, breaking of that fatigue cycle that develops, particularly with individuals with cancer. So these are your learning outcomes. Again, utilize these to help you kind of study and organize. Again, and I would include under the develop exercise recommendations, again, so you have your exercise recommendations, but also keeping in mind that the precautions would fall underneath that as well. Probably just, as important to remember, because that kind of will help you, if you're having the opportunity to work with somebody that has cancer, allows you to kind of work with them and know when you kind of have to change, or in most instances, in those cases, back off of your exercise intensity, so problems don't develop.